I'm Connie Witt from Moab. I'm 70 years old, and I'm not thrilled at the idea of being filmed, but I'm very appreciative of what this procedure's done for me. So, came first with knee issues. I have had chronic knee pain for decades since a skiing accident, and I been to an orthopedic surgeon because my son had had some artificial fluid injections in his knees and they did well for him. But the surgeon told me that I was too chronic and I'd need the injections too often, and that I was facing replacement in both knees because I was bone on bone. And so I was looking for alternatives to that. And so when I heard that Ray was doing these injections and that it was based on not having to keep doing the injections forever, but that make your own system, your own tissue work better again. So I started with the knee injections. I'm a hiker. I do Zumba, I do water aerobics, yoga, and that's very important to me to keep active. So what it used to be, I would just try to tune out knee pain. I tried hiking sticks, and I could turn it out, except for if I did a long hike, then that evening going up and down the stairs, I couldn't ignore it. And so the first thing I noticed after the injections was that I was noticing when it hurt because it wasn't hurting all the time. So I'm not saying I have complete freedom from knee pain, but it's when I notice it, it's the exception rather than something I'm trying to block out all the time. So I've also had lower back issues, and again, kind of scared of back surgery. I'd gone through a series of steroid injections under a fluoroscope and couldn't have those too often, and the arthritis buildup was such that they told me it wasn't working so well anymore. So once the knees worked so well, I was interested in trying the back. And the best example I can think of is that I have long airplane flights when I have to sit in the same position or stand on hard surfaces. It's one of the reasons I retired early from teaching, is just standing on hard floors got to be too much. So once on a flight to Australia, I had such bad back pain I had to keep getting up from my seat and couldn't really walk well for about a week after the flight. So I had my first injections just before I flew to Europe. I had a 10-hour plane flight and no back pain. And then playing tourist, I had a lot of standing in lines at museums, and I'm not saying I didn't feel my back at all, but I could do it and enjoy it. And I did a 200-mile bike trip and had no issues with my knee or my back. So I'm happy with my results.